This is the time of year when flu cases normally start to tick up, but doctors are noticing a different pattern this year. The Centers for Disease Control and Prevention says more than 189 million flu vaccines have been distributed in the U.S. this flu season, compared to 174 million last season. Data analysts at Walgreens, who track sales of flu medication, say flu activity in November was about 91% lower than in November of last year. Case numbers are down in Wisconsin, too. New at 10, Caroline Dade has you covered on what role COVID-19 precautions are playing.
Like so many other things this year, flu season looks different than normal, according to UW Health's Dr. Nasya Safdar.
In general, for most of the seasons in recent memory, now is about the time that we would have started to see a rise in cases.
Are we seeing that this year?
We are not seeing that. There's hardly any cases of influenza anywhere in the state.
Hardly any cases isn't an exaggeration. According to the most recent data from the Department of Health Services, there have been 24 lab-confirmed cases of the flu this year. At the same time last year, there were 712 confirmed cases. Safdar says she thinks coronavirus precautions are causing this drastic decline.
The reason why we think that's the case is probably a combination of masking, physical distancing, and people altering their behavior.
But it's not just cases that are down. At this point last year, more than 160 people had been hospitalized because of the flu. This year, that's only been the case for 5 people, and flu deaths are down too. 7 people had died by this time in 2019. This year, there have been no flu deaths. Safdar says this trend is helping the most vulnerable people in our communities.
If there isn't much transmission happening, then it's reasonable to think that those people are relatively protected, and that's why we aren't seeing the hospitalizations we would normally expect to see.
But she says we're not out of the woods yet.
Given the unpredictability and what we know about the virus, even January is not too late for cases to rise, nor is February.
And even if this year's flu cases stay low, that won't necessarily be the case next year.
Influenza will return in some form or the other, and some seasons will be worse than others. But there is a vaccine for it, and so if people will remain as excited about getting it as they did this year, I think that will have been a good thing then.
In Madison, Caroline Dade, 27 News.